Welcome to the Exam Room Podcast, brought to you by the Physicians Committee. Hi, I'm the weight loss champion, Chuck Carroll. Thanks so very much for watching and downloading in more than 150 countries around the world and making the Exam Room one of the most consumed nutrition podcasts anywhere on the planet today. And we are stretching our boundaries, and we are all the way here in Rochester, Minnesota at the Lotus Health Foundation Symposium and Gala. And we are joined by a friend of the show, a longtime guest, a friend of mine, and someone with an incredible breast cancer story. Allison Tierney from Wholesome LLC. Welcome back to the show.
Thanks so much for having me, Chuck.
How in the heck are you?
I'm actually doing really good.
Good.
Yeah, but a lot has happened since I talked to you last.
You don't say.
Yeah.
Yeah. When last we spoke, you were in the middle of chemo.
Yep.
You had breast cancer, which is just, as an oncology dietitian, I find just tragic.
An ironic twist is the way that I like to say it.
Yes, yes. But looking at you today, you look like you are doing fan-freaking-tastic.
Thank you. Yes,
Yeah.
I'm doing quite well. Thank you.
How have the last few years been, Allison?
Oh, goodness. The last few years. So right now it's April of 25, and I was diagnosed in May of 2022. So almost 3 years since my diagnosis.
Yeah.
And I have been on the show before and shared a little bit of my story, but just to like a quick recap, I was breastfeeding my second child, and right after that just had a regular annual exam with my physician, found a lump in the breast at that time, but we didn't do anything about it because I just finished breastfeeding.
Yeah.
And then went home and continued to feel the lump because as an oncology dietitian, right, I was very well aware. I have an extensive family history of cancer, including breast cancer in my mom. And I started to become more aware of it. And the only thing that I can usually tell people is that every time I felt it, I felt anxious.
Yeah.
And I was actually preparing for a conference that I was speaking at, much like this one here today that we're at. And I thought, you know, I think I need a little reassurance before I go stand on the stage and talk about breast cancer nutrition.
Yeah.
And that's when I reached back out to my doc and said, you know, I have this lump, it hasn't changed. I've had a cycle, it still hasn't changed. I think I need a little extra reassurance here. And thankfully, quickly, she got me in, did an ultrasound, but that ultrasound led to mammogram, biopsy all on the same day, and diagnosed 48 hours later, which they were pretty confident that they knew it was breast cancer that day already.
Right.
And ended up, long story short, diagnosed with breast cancer, or initially DCIS, which is when it's still contained to the mammary gland.
Yeah.
Then I opted to have a double mastectomy with deep flap reconstruction, which is recreating the breast out of your own tissue. And out of that surgery is when they found the pathology of the cancer was actually not DCIS. It was invasive ductal carcinoma, which means more testing, tested triple positive for all 3 receptors of breast cancer, which meant 3 months of chemotherapy and immunotherapy and another 9 months of immunotherapy. So I've had that and an additional 2 surgeries since then, and I'm praying and crossing my fingers that I'm done with surgeries.
Yes. So all of that, even though you had the double mastectomy at that point, wow.
Yeah.
That's a lot.
Yeah, it was a lot.
Yeah. And yet you're here with a smile on your face.
I am.
Yeah.
Yeah, absolutely.
Wow. Outstanding. I mean, I don't want to ask such a softball, almost stupid question, but how was that process for you? I mean,
Yeah.
I've heard horror stories from some women, and I've heard others who have gone in there who were healthier despite the cancer diagnosis and eating a healthy diet, and they tolerated the treatments a little better.
Yes.
How was your experience?
Absolutely. I feel very lucky to have the knowledge and the support that I've had throughout this whole process to be able to tolerate surgeries and chemo the way that I did. And I think the first telltale sign of going in, and I think when you're first diagnosed with cancer, and especially I was 33 years old,
Yeah.
right?
Yeah.
And I think one part of my story is that I have always been a healthy weight. I've always been physically active. I was a college athlete. I didn't drink ever. I didn't smoke. Like, you know, you can cross off the list of the things that you shouldn't do to help lower your risk of breast cancer, right? And here's a 33-year-old female who's, I'm going to put in quotes, done all the right things, because none of it was perfect, and I never will be perfect. And I'm diagnosed at such a young age. Now, out of that, I did find I do have a genetic mutation. And so when I was first diagnosed, you know, I thought to myself, gosh, what did I do wrong?
Yeah.
And I think that's the case for a lot of people that are diagnosed with cancer.
Yeah.
Right? And it took some mental rewiring and talking to myself to really talk about, okay, all the things that you have done that have helped, yes, lower your risk, right, are going to be what powers you through this. And I think that I can be a testament to show you that nutrition, lifestyle, all the things are so crucial to help get through treatment. After I had my double mastectomy with deep flap reconstruction, so what they do is that you have a breast surgeon that removes the breast, and then the other surgeon, you're essentially taking tissue from your abdomen, and there could be other sites that people get tissue from. For me, it was the abdomen, and then recreate the breast with that tissue.
All in one procedure?
All in one procedure.
Wow.
It's about an 8 to 10 hour procedure, 12-week recovery, and I had a 14-month-old baby and a 4-year-old. Right?
Yeah.
And so it's a huge recovery. Thankfully, again, I had the support of the village around me. But after that, I went to my follow-up with my breast surgeon 2 weeks later, and I walked to the hospital for that. Now, it was not very far. I do need to preface that. It was about 0.6 miles, right?
That's a
but
huge
it's
victory.
And it is. And, I have a huge scar from one hip to the other, right? So it's a
Yeah.
very big abdominal surgery.
Yeah.
And when I got there, I walked with my husband, and then I had my father on standby of, like, in case I can't walk back, will you come pick us up type of thing, right? So I was being smart about it. But the breast surgeon said, "You did what?" And I was like, "Well, we walked here. I feel good." And she's like, "Don't tell anybody that you did that, because you're going to make this surgery look really easy." And I have mixed feelings about that, of the response, because there wasn't any other further talk about, but how could you have walked here in 2 weeks later, right? And I didn't walk fast. I didn't walk a lot more, but I do truly believe that my nutrition, lifestyle, everything that I had going into that was what allowed me to heal the way that I did. Tackle chemotherapy 6 weeks later, 3 months of chemo, and then another year. Like, I don't know that I'd be sitting here with you with a smile on my face in the same respect if I didn't have those things on my side.
Do you think that just the anti-inflammatory nature of your diet helped speed up your recovery?
I think that's certainly part of it, yeah. And I also think what's really important too is I am a dietitian, of course. I am so biased and love nutrition.
Nerd out, girl.
Right, but nutrition isn't the only thing that got me there, right? And I credit my work in counseling and my mental health and my mental approach as part of that process too, right? So, but we all, I'm going to say we don't all, but many of us are familiar with the connection of food and our mental health, right? And I think that played a role in helping me assist in to do the things that I did. Or the fact that my daughter was in kindergarten when I was going through chemo, and I still walked her to school every day.
Wow.
The day before chemo, like the day of chemo. Like, that was our routine, is we'd get up, I'd walk her to school, my husband and I would get in the car, and I'd go to chemo. And I remember people saying, like, why are you walking to school? And to me, that was my medicine, like mentally, emotionally, physically. So I think that all of those factors played a role, but that's not to say that there weren't hard moments. And there still aren't hard moments. I mean, I still face that fear and anxiety and survivorship, on every now and then type of thing.
Of course.
But it's really what has given me the inspiration, the empowerment to move forward, even when, what I like to say, the deck of cards that I was handed in my life when it comes to health have not been ideal. I mean, we've been on this podcast before when we first met, when I was talking about PCOS and infertility, right? And then I have familial hypercholesterolemia, right? I have this deck of cards that isn't great, but to me, it's all about how I play the deck of cards. And sure, life's not fair, and there are a lot worse things that I've had to deal with that other people have had to deal with in their life. And I think it's that approach and mental mindset and how nutrition helps be that foundation for me.
Yeah, boy. And that takes me down, I wasn't expecting to go down this, but since shame and guilt came up yesterday here at the Rochester conference, I want to ask you, when you got that diagnosis, being that oncology dietitian, even though you had that family history of this, was there shame? Was there guilt?
Absolutely. Imposter syndrome?
Yeah.
Absolutely. Like, how could I be an oncology dietitian that helps people reduce their risk of developing cancer in the first place and reducing their risk in recurrence and help their treatment? How could I, as a 33-year-old, say that these things make a difference, right? I had to question to myself, what's the point in all of this if I still got cancer anyways? And that was the overcoming, the rewiring of like, yes, you did these things, but they may have helped you more than you could ever realize. Like, what if it wasn't caught at the stage that it was caught at?
Yeah.
Right? Well, did those things help prevent progression quicker, right?
Yeah.
We'll never know that information, right? So absolutely, there was guilt, shame, imposter syndrome, all the things. And then also, should I be continuing to work in this space if, I have the social media comments of, well, if you've got cancer, what's the point? Or what's the hope for the rest of us?
Yeah.
And I want to use my story to share that even though something bad and tragic can happen, like you can still be empowering and control the controllables to help you live a full life even after cancer.
Yeah.
And I like to teach people that you can actually live a better life after cancer if you allow it to happen.
Ooh, what do you mean by that? Unpack that. That seems like a pretty profound statement.
Well, I think it's the concept and the idea that cancer can be your teacher if you'll allow it. And I think that also relates to so many other things in our life, right? Not just cancer, a chronic illness, right? Your journey that we've gotten to hear about, right? If you let that be your teacher, you can learn greatly from it. And that cancer has taught me so many different things, not just nutrition, not just the idea that these things helped me through, but the power of my mind, what's really important in life. The value of the mundane things, right? I mentioned that I had a 14-month-old when I went through this surgery. Most parents, I don't think, would ever think that they would miss changing their child's diaper.
I wouldn't think so. I'm not a parent, but
Right?
that just doesn't seem like a high, yeah, that's going to get me out of bed in the morning.
Right, but I couldn't lift my child. I couldn't hold her for, I think it was actually, I still will remember the moment of when I lifted my oldest for the first time after surgery. We were at an apple orchard and someone was like, oh, can we take your picture? And I said, sure. And I just picked up my oldest.
Didn't even think about it.
And didn't even think about it. And the first thing she said to me was, Mama, you just picked me up for the first time in a really long time, right? And my kid recognized that, right? But the value and the importance in what we consider to be mundane every single day are the things that you miss, and you'll do everything you can to fight to have back.
What did you think when she said that? Did you just melt?
Oh, of course I cried. Thankfully I had sunglasses on. But yeah, and of course to this day it still sticks with me about not only how that journey is also impacting me, but how it's impacted my kids and shaped my kids. And I've also worried about how my cancer journey would negatively shape my kids. But I think it has positively shaped them in many different ways. And I don't want it to be a fearful thing, right? I don't want them to have fear about developing cancer, especially with this genetic mutation that they may carry. I want to empower them to live healthy lives as kids. That's not fear-mongered or fear-based, but really just an empowering basis so that they can protect their lives too.
I would think in some ways it would be not therapeutic, but it would take away the boogeyman from under the bed when it comes to facing this, because you saw Mom was able to get through it. Not that they're anxious to go through it themselves, but if it does happen, look at how well Mom did.
Yeah, and and that's what I told my oldest when I was first diagnosed. I said, did you know that Grandma had breast cancer? And she said, no. I said, and look at how healthy and active Grandma gets to be with you. Mom's gonna do that too, but we just have to take care of other things first.
Yeah.
So I might be a little tired or a little sick in between then, but Grandma did this too, and Mom can do it too.
Are they cool? Like, they were super helpful on your, on your recovery?
My parents?
Well, your
or
parents, your kids? Yeah.
Oh, everything. Yeah. And I remember when I first came home from that first surgery, and I walked right up the stairs, and I remember my father-in-law being like, you just spent 3 nights in the hospital and you just walked up the stairs like it was no big deal, right? But she comes and she brings me a bell, to ring, and the kids monitor. She was instrumental in helping me strained my drains and everything from surgery. So,
She was straight into drains?
Yes.
Wow.
Yeah. So pretty cool stuff. Maybe we have a doctor or a nurse in there. I don't know.
Maybe.
I was glad I didn't have to take care of the drains. I let my husband and them do that.
Yeah, for real, man.
I joke there's a reason I became a dietitian. It's because I really like medicine and that, but don't blood and needles.
Right. There's a line for everybody, you know.
I meant
you know
to be
what
on this
yours
side
is.
of it.
Yeah. Can you give us an example of what your diet was immediately leading up to the procedure and then during the recovery phase? I'm sure that there's a lot of people who unfortunately are kind of in the midst of that themselves and are like, okay, I may not have had that healthy lifestyle leading up to it like Allison did, but let me start today.
Yeah, absolutely. And it can start with something small, like adding more greens to something really simple and easy, right? Even things that you don't think about adding dark leafy greens to, just throw a handful on. That can make huge changes because you're adding those anti-inflammatories and so forth to it. Now, preparing for surgery, I do tell people that you do need a little bit more protein for that recovery, but you don't need this crazy huge amount and slamming protein shakes all the time or anything like that. So I was more conscious of making sure that I was adding plant-based protein to a little higher level because I also knew that I was gonna need it post-surgery. Other sources of nutrients that I focused on that I encourage others to focus on prior to surgery is gonna be zinc, iron, and omega-3 fatty acids, because those are all shown to be really helpful in wound recovery, surgery, etc. So some of the many things that I focused on prior to surgery were also what I focused on post-surgery.
Gotcha.
In order to do that, but also making sure that I had a variety of foods and so forth. And that also, I think can be really hard with that is the support that comes with it, right?
Right.
There's a lot of people, which is so wonderful, that want to bring you meals that maybe aren't supportive of your healing. And I usually tell people, especially the clients
The meals
that I work,
aren't supportive of the healing.
Sorry,
the person bringing them absolutely is.
Absolutely,
Yeah.
yes. So it's also okay to tell people what you need.
Right.
And I've been the caregiver of a cancer patient, and I've been the cancer patient. And so I have to remind a lot of the caregivers that we know you want to help, right? And so I guess I need to tell the patients that your caregivers want to help, and they often don't know how to, and you just need to tell them what you need. And so it's okay. A lot of people say well, I feel bad for saying I need this in my meals or I want this in my meals, but they're already bringing me a meal, so I don't want to say this particular thing. And it's but they don't know what to bring. So if you can just tell them, it makes it easier for all parties.
Yeah.
And so usually for my clients, I tell them, you can say, blame your dietitian. My dietitian says that I have to have this, this, and this. Here are meal ideas.
Right on.
Right? Yeah.
Right on.
So I think it gets a little tricky with support and fatigue and the things that you're experiencing during all that time that can make some of the lifestyle changes more difficult just because of the circumstances.
And when you were having, I don't want to paint an overly rosy picture because were some difficult days. How did you pull yourself out of those doldrums?
Honestly, I say frequently that my kids were the hardest part about having cancer, but also the best part about having cancer. And I say that because it was really difficult for me, and still sometimes difficult to look back, because my youngest was so young. I feel like her between that 14 months and maybe even her third birthday, it was a blur. I feel like I missed so much of her growing up in that time frame, and that's really hard for me. And I couldn't parent the way that I wanted to parent. I couldn't be present exactly the way that I wanted to be present, right? So that's the downfall of it. But the positive was they had to get to school.
Yeah.
And my husband did so much and still does. He's working full time, taking care of not only 2 kids, but his wife. So really,
shout out to the hubs.
Yeah, right?
Attaboy.
Yeah, and so, but they were also what pulled me out of bed.
Yeah.
Because I have to get her to school today.
Yeah.
My husband has to work so we can pay my medical bill. There's no and so I would say that they were the ones that pulled me out of the doldrums when I needed it most, because they brought so much joy and laughter even when it was hard. And they do have that level of innocence that's pretty nice.
Yeah.
My youngest still doesn't understand what cancer is, and part of me doesn't want her to just yet,
Not yet.
So I would say that was probably the biggest help for me.
Yeah, the why is super important, isn't it?
Yeah, absolutely.
All right, one more food question. Going back to, people don't understand the well-meaning ones, this is what I need, but what are the really foods that somebody should avoid? Is it, is it the beef? Is it the pork? Is it, any kind of meat? What
Yeah.
would be on that list of no fly?
Yeah, that's a great question. I think it does a little depend on the cancer type, right? We have more research geared towards different types of cancer. So for example, colorectal cancer, we absolutely want to be a little bit even more mindful about processed meat and red meat, highly linked to colorectal cancer. So it kind of depends on what that person's diagnosis is, but across the board, red meat and processed meat. Unfortunately, I think you're the bearer of bad news when you tell them that alcohol is not good for it, for cancer, right?
I would imagine that a nice glass of wine, Chardonnay, or even a beer, when you're just trying to get a little bit of an escape.
Yeah,
Sounds
exactly.
good, but
and I'm from Wisconsin, so I like to joke the land of beer, cheese, and sausage, right?
Oh man, that's the trifecta.
There's not a lot of good in that.
Yeah.
So I think it's really difficult for that. But I think it's important for people to know what they should reduce in their diet or aim to avoid or minimize. But I personally like to really focus on what they add instead, right? Because I do think that if we can focus on adding before subtracting, those other things are going to be naturally crowded out because they're going to start to feel better. They're going to start to notice how that particular food might make them feel.
Yeah.
I use the saying a lot that a lot of people don't realize how bad they feel because they've never felt good.
Right.
And so if we can help them start to feel a little bit more of that good, they're going to crave more of that feeling good, right? And it's funny because I have an older brother who was somebody that I never thought would eat anything green, to be honest, right? And he's told me, spoiler alert, he's now completely plant-based, totally flipped his life over from that standpoint. But I remember he told me that years ago. I told him that. I said, I don't think you know how bad you feel because you've never felt good. And he said that always stuck with him. But I never pressured him to change. I never pressured him to do those things. I just led by example.
Yeah.
And he did say later it was that and watching how much food supported me through the process that he thought it was time for him to start doing the same thing.
What's his name?
Nate.
Nate. Attaboy, Nate. We'll give you a clap for that one too. Good deals.
Yeah.
So what's the future look like for you? You've had all of these surgeries, the mastectomies. Have you talked about the risk of recurrence?
Yeah, absolutely.
What are doctors telling you there?
Yeah, thankfully, I was a stage 1, so I was caught early because I was triple positive, which is why I also had the chemotherapy and the targeted therapy. You require chemotherapy for that to be beneficial. I was triple positive, which means I was positive for estrogen, progesterone, and something called HER2 positive. These are the types of receptors, essentially the fuel or what fuels the cancer growth, right? So I was positive for all 3 of those things. I feel very blessed that HER2, that third one, used to be a very, very highly recurrent cancer until about the early 2000s, I believe, until we were able to find this targeted therapy that drastically reduces the risk of recurrence. So I feel very thankful that I live in the time that I live in, that it was almost a death sentence beforehand, and now we have this awesome targeted therapy that works really well into helping. So, with that being said, my risk of recurrence is actually quite low, which I'm so grateful for. And especially because I did do the surgery, the treatment. I was recommended a medication that I would take for 10 years. I tried it out and had some negative side effects that I really truly did tolerate the medication really well. However, we stopped it for a short period of time for some GI issues that I was having post-chemo, since we thought maybe that was playing a role. And it wasn't playing a role in the GI issues, but then I started to feel so much more like myself.
Gotcha.
So even though I was tolerating it quite well and considering, I went back to feeling more like my normal self. So with my oncology team and my own discretion, we decided that I would stop that medication.
Gotcha.
To me, it was really important to live a high quality of life, and I weighed those options. And so am I taking a risk by not taking it? Yes. but I also really value high quality of life and lifestyle medicine, and those things were very important to me. So when it comes to risk of recurrence, I have stopped taking that medication, but I'm on surveillance for quite some time.
Surveillance?
Yes,
I'm being surveilled.
Yeah, yes, that's the word for it, is surveillance. And I feel very hopeful and that all the things that I'm doing, again, are controlling the controllables and just helping me do the best that I can to reduce my risk.
Can I ask you, and I think this is a guy kind of a question because we don't know about this. How does one check for lumps when you've had reconstruction surgery at this point?
Yeah, great question. Yes. So even though I've had a mastectomy, I still am at risk for recurrence. However, the risk is very low because we're human, right? And so the surgeons try to get every possible breast tissue gone. However, human, right? There could be cancer cells that were left behind in breast tissue, but that percentage is very, very low, although it does happen.
Right.
And so you could have recurrence in the breast, but the other component, since it was an invasive ductal carcinoma, that invasive component means that although it was no longer just contained in the mammary gland, it could have microscopic cancer cells could have spread to other areas of the body and taken up space.
Gotcha.
So essentially that's where the systemic treatment of chemotherapy and targeted therapy are to help prevent recurrence that has happened elsewhere in the body, which would also be metastatic.
Gotcha.
So there is a small risk of breast cancer in the whatever remaining breast tissue there is, although they try to make it as nil as possible. I'm actually at greater risk of more of a recurrent that maybe had metastasized because of that invasive or because of my genetic mutation, some of the other cancers I'm at risk for because of my mutation.
Gotcha. Well, I hope that the future is extremely bright for you.
Thank you.
And no matter what happens, you're built to last, Allison.
Yeah,
you're built
thanks.
to last.
Yeah, God keeps giving me lots of challenges, but none that He hasn't given me the tools to handle. So
Girl, you just love climbing over those walls, man. Obstacles, man. No, we're just gonna clear this hurdle. You got another one? I'll clear that one too. What's up? I'm Allison. That's you, right? That's cool.
Yeah.
You're Wonder Woman and a great role model for your kids.
You.
And your clients are definitely lucky to work with you as well. We're going to put a link to your website down below, all your social media.
Sounds good.
Yeah, we'll take good care of you because
Awesome.
you take great care of us today.
Thank you so much, Chuck. It's a
Thank
pleasure.
you.